I meet many patients who develop metastatic brain cancers. There's two main pathways that they come through or that the tumor is diagnosed. The first is that some patients will be undergoing surveillance of the brain. If they have a certain type of tumor that has a high risk of spreading to the brain, they may get an occasional CAT scan or MRI of the brain looking to see if any brain tumors have developed. These patients will have their tumors found what we call incidentally, meaning they haven't developed neurologic symptoms or headaches, but rather that we were checking with a screening test and found the tumors. The other group are people who develop neurologic symptoms. Because the tumors grow in the brain, the metastatic tumors, both by the size of the tumor and by swelling around the tumor, can produce neurologic symptoms. This can be weakness, speech trouble, headaches, vision problems. Anything that the brain does can be affected by a tumor that grows up in that particular area of the brain. In a patient who has cancer and develops a neurologic symptom, a brain tumor that has spread must be suspected and evaluated immediately. Many of my patients who have metastatic brain tumors are under the care of an oncologist who specializes in treating their lung cancer or their melanoma or their breast cancer. And that physician may be monitoring the patient for any neurologic symptoms or for new findings on a CAT scan or MRI scan of the brain. At the time when a brain tumor is found, that patient may be referred to me as a neurosurgeon or to a radiation oncologist, and the three of us, the medical oncologist, the radiation doctor, and the neurosurgeon, will work together to find the best treatment plan. For most patients, MRI is the workhorse of making the diagnosis. It shows us the brain. It will pick up almost all tumors that are larger than 3 millimeters, and it will show us the location, the size, the amount of pressure, and very importantly, the number of tumors. When we choose a treatment for a patient or recommend a treatment to a patient, the key variables for us are how many tumors are there, and obviously the fewer there are the better. 1 is the best number. The kind of tumor that has spread there, lung cancer, breast cancer, melanoma, how big they are, is there any sign of bleeding from the tumors, has there been any swelling, and is the patient having symptoms? And we use all of those factors together to recommend the best course of treatment for a patient.